How you doing?
Good.
Good. Glad you can make it.
Sure. Hi everyone. Today is the 17th session and welcome everyone. Dr. Serena, the show is all live on Facebook and it's being recorded.
All right. Well, welcome everyone. Thanks for joining us today. And thanks, Lori and Mike, for being present today with us. And I wanted to, talk about a few different things, because it's been a few weeks, a few months actually, since I've been doing this solo, since we've had some guest speakers. And in 2 weeks, we will also have another guest speaker joining us. Hi, Cheryl. Thanks for joining. Um, and so, some of the things that have come up in the last few months, I thought were really important to bring up and to just develop some awareness around and talk about how they relate to mental health and substance use disorders, especially when we talk about, the pendulum and kind of how do you find a balance, between these extremes. So, for the month of October, since we're starting that, there's a lot of different things that this month is known for in terms of becoming aware. And so September also had a lot of different topics. And so I'm going to talk about how to develop some awareness. And I do want to focus a little bit on awareness related to depression, because this is a mental illness awareness week, is the first week of October. It's also, I'm just going to go to the next slide here, but August was Civility Month. And so it was related, it's related to, what it means to be civil. And we're going to talk a little bit about that and what civility means, and also how that relates to your mental health and how it can relate to other people's mental health. And what are some things you can do for yourself, what you could do for other people, to increase the practice of civility. Hi, Erica. Thanks for joining. So here's like a little hi. Here's a kind of an overview of some of the different things October is known for, in terms of national and some weekly and some day awareness topics. And so, one of the main ones is National Depression and Mental Health Screening. I am going to kind of talk a little bit about depression, because I think that is important, particularly since we're going into winter months. And there tends to be an increase in depressive symptoms, and some of that's related to the weather, some of that's related to the holidays, some of that's related to the lack of sunshine. And so I do want to talk about that as a screening tool too, and just to recognize that, if there are more increased symptoms, that, it's important to get the help and assistance that you may need so that the suffering is not continued. It's also Domestic Violence Awareness Month, and in 2 weeks, we will have a guest speaker that will talk more about that. So I'm very excited to bring on this person who was generous with her time. She's worked in the field for a good 30 years, and so she has a lot of experience and expertise in it. It's also Asexual Awareness Week, which is the last week of October. And I put this in here because, we often don't talk about sexuality. And so I was, just surprised that there was an awareness week related to one way of this being in the world. And so Asexual Awareness Week is the last week of October. And of course, most people are familiar with National Breast Cancer Awareness Month. This is the Think Pink. And I just realized I put it in a pink box, so I didn't do that on purpose, by the way. So National Bullying Prevention Awareness Month, Global Diversity Awareness, Learning Disability Awareness. I think that's also a very important one. And then, of course, Pregnancy Infant Loss Awareness. We don't often talk about infancy loss and pregnancy loss, miscarriages, abortions, crib death or SIDS, things of that nature. Those are not things that are normally talked about in different communities, whether they be intentional or unintentional. It is not what I'm referring to. It's more of just the fact of the loss, and bringing awareness to that. And so some of the important awareness dates in September were related to National Recovery Month. National Recovery Month is really huge for September with alcohol and drug recovery. It's also self-care awareness. And so really they have a day where you literally take care of yourself. It's also National Suicide Prevention Awareness and then National Pain Awareness. And that's the resource that I get all these dates from so that you can also check out some dates for yourself. There's a lot of really great awareness days too. So there are specific days that may relate, like October 10th is Depression Screening Day. And so you might find that different pharmacies or different facilities around you might offer free depression screenings. And that is in service of this. So National Depression and Mental Health Screening is actually offered through NAMI, the National Alliance for Mental Illness. And so I want to just kind of briefly first talk about that first. I'm going to stop sharing this screen. I want to pull up something related to NAMI. And I'm going to share that as well and kind of talk a little bit about, depression in and of itself, because people may know about it, and at the same time, we don't often talk so much about it. So this is a resource that is available to everybody. And NAMI does have a lot of different support groups for individuals. But really recognizing what is depression and, given that it is a depression screening month, really recognizing that depression can kind of manifest differently in people. A lot of times people may think that it's just it's changes in symptoms that they're having may relate to stress that they're experiencing or, maybe something that they're eating, but really recognizing that when there is a pattern of changes that we want to acknowledge that there may be something else. And that's what screenings and being aware is really about. It's recognizing that this might be something different. And that's all we're giving awareness to, is that it might be something different. And so these are some common symptoms related to depression: changes in sleep, changes in appetite, lack of concentration, energy, lack of interest in activities. It could also be like a decrease in interest in activities that a person has had. So it might look like, things that a person was usually interested in, they don't just seem appealing as they used to be. And again, when we talk about doing a screening or an assessment on this, we're really looking at, is this a change in a person's values, or is this a change in the person's, overall change? And that's why screenings and assessments are important, because, this way we can, as clinicians, we're able to help with the questions that we ask to help you in understanding, okay, is this something that's related to a depression, or is this something just kind of a transition? There's hopelessness or guilty thoughts. Maybe there's changes in movement. So a person may actually have less activity than usual, or they may be more agitated or restless, feelings of restlessness. There may be more physical aches and pains, and some people may experience more somatic symptoms. In some people, depression may come out more physically as opposed to emotionally, or more cognitively as opposed to emotionally. And so that's one way also that the screenings are important to get. So I'm encouraging people to do a depression screening on October 10th as well, just to, for your own mental health, basically. And then, of course, suicidal thoughts. Those are part of depression as well. And so there's lots of different causes, that occur and can be the basis of depression. And there really is no one way of describing how depression or why a person gets depression. And so it really is an individual thing. The idea is recognizing that, if it's present, that's what's dealt with. And recognizing that it's multifactorial, causal, and also that there's lots of different treatment options. So I just wanted to bring some attention to that, given October is the awareness month, and kind of talk about, what that may look like for people. So I'm going to share my other PowerPoint here, and where am I at? Here we go. All right, so yes, here we are with the other depression. So one of the things then too, looking at awareness, here we go, is what does it mean to be aware? And, I often get asked this question. And so I attended this conference online yesterday, and it's a Gestalt international conference. And Gestalt is this therapy approach that's used. And part of the approach involves moment-to-moment awareness. So you are a person who is embodying Gestalt or is Gestalting, is aware of kind of their experience in the moment and that process. And that's what awareness basically is that you are understanding and knowing of something as it's happening or in existence as it's happening. And some synonyms that relate to this is, the attention that you give to it, an observation, noticing, being conscious, mindful of it, and just recognizing there's this presence of something. And so when we talk about awareness, I'm wondering if any of you have any comments you want to share related to this definition, or what this may mean to you, or your experience with awareness. I don't know if anybody wants to comment before I move on. I'd like to leave it open for a moment.
Mm-hmm.
All right, we'll move on. No worries. I know it's a
Dr.
lot. Oh,
Serena, sometimes like awareness, many of people don't even realize what awareness means. They think it's visually watching something, looking at it, but this is much deeper than what the eyes can behold.
yeah, that's a great comment. And absolutely, it's not just kind of visually seeing something. This is really, it's the recognition that something is present. So that could be something internally present or externally present. You're just consciously observing and noticing that there is something in existence, right? So you can have awareness about multiple different things at the same time. And it's not uncommon for us to be aware of things multiple, like think, for example, when you're driving a car, you are aware of multiple different things, but because the brain is so trained to recognize and to pay attention to, the driving, right? And it selectively, diverts attention and awareness to what it needs to. And so your awareness then is directed to what the brain is doing. And yet you can consciously shift that to different things as well. Oftentimes I hear people talk about how, yeah, I was driving and I can't even remember how I got here. It just kind of like happened. And it's like, well, yeah, because you weren't aware. The process of getting there was something that was so routine, so to speak. And so, people have heard about mindfulness practices. That's what mindfulness practices are, is being, more consciously aware. And it's more of an intentional direction of your attention. And so you are paying more attention and putting that effort into, well, what is happening in this moment? What's going on? What do I observe occurring, whether it be multiple things or one thing or whatever. And that could be overwhelming for some people too. I know when I work with clients and we talk about doing this as an activity or something to help them, particularly with certain treatment goals that they have. Really it's about baby steps, so I may say, okay, well, let's work on one small thing first and kind of see what happens with that. And so it might just be paying attention to, body sensations, that while you are, maybe eating, you're paying attention to what's going on physically in your body, not what you're thinking, not what you're feeling, not what's happening around you, but really just, what your physical body is telling you. Or you may be paying attention to what thoughts you're having while you're eating and noticing what's going on with your cognitions, what your thinking patterns look like. And so you can develop different levels of awareness, by directing your attention to something in particular. And it does increase different things for different people, and also allows a little bit more freedom in things too. I mean, I've had clients that, and I do this exercise with my students as well. And, they talk about how there is more of kind of a knowing of their own experience. And I think that's one thing that sometimes, we don't have a lot of, is that we don't necessarily know how we are being in the moment. So kind of like our own experience in the moment, it's kind of challenging to know, and unless we're paying attention to it. And so I pose that as a challenge, is kind of just to be aware of what it's like for you in this moment right now, even as you're sitting here or listening or digesting some of this information, paying attention right now in this moment to what's happening with you as this information is being shared. What do you notice in your own experience occurring? Like, are your thoughts wandering? Are you noticing any physical reactions? Do you notice, your breathing patterns changing? Like, that's a level of awareness that you're directing your own attention to in the moment that something is happening for you. And that's what awareness is about, really. So I appreciate that question, and I hope that kind of helps give a little bit more structure to what it might look like for people.
Serena,
Yeah.
we were talking about the physical awareness, like
Yeah.
with driving a car, eating, and that kind of thing. But I think there's a lot to be said too about emotional awareness
Absolutely.
for a person. Sometimes it's obvious. Sometimes we are oblivious to it.
Yeah.
But that's very important too, to be aware of if something happens, even if it's something minor. Has it upset you? Has it offended you? Has it hurt your feelings? Has it made you mad? And I think that's an important aspect of it too.
Absolutely. And I appreciate you bringing that up too, is just recognizing, excuse me, an emotional experience that you're having to something. Yeah, because a lot of people tend not to. They want to like not feel something, right? Right.
Right. Especially
yeah,
negative. Yeah.
especially yeah, like people don't want to feel negative emotions, right? And oftentimes that's what gives room to ways of trying to maladaptively cope with that. Like, I don't want to feel negative stuff. So in order to not feel negative stuff, how do I avoid it? How do I suppress it? How do I ignore that? And so people might engage in behaviors that end up becoming more problematic for them. And so, yeah, I appreciate you bringing that up, because it is important to look at, particularly what you said, as you were saying that, I was like, oh, that is an important point, that how did this person's comment or this experience affect me emotionally? Am I hurt by it? Am I curious? Am I reacting to it somehow? And what does that mean for me, kind of a thing?
And then we have to learn how to cope with it,
Yes,
whatever
yes.
whatever that answer is.
Right, exactly. And that takes it to a different level then too, is recognizing having that ability to do that. And some people have it and some people don't. And so that's also something that can be developed, is learning skills to help regulate those emotions. Right. I mean, and I think that's important to emphasize, is that, the ability to regulate emotions is a skill and it can be learned. And so I remember when I was teaching an emotional, like a skills group to clients, years ago, and it was a 6-month program, and they would come every week for 2 hours to learn these skills. And we talked about how these are skills that, for whatever reason, you were not able to get as you were growing up. And so you're learning them now because you recognize that you want to learn them, and do things differently. And that's awesome. And that's why you're here. And so it was, being aware of that, right? They had to have that quality of awareness that they wanted to do something different. So I appreciate you bringing that up, Cheryl. Thank you.
Yes.
So here's like some things that you can do, to kind of develop this awareness. And I kind of already talked about these things, but, you can observe, for yourself, and get feedback for yourself. I think sometimes getting feedback from others, and, that's a whole separate podcast maybe we can do, is how do you get feedback from people? Because oftentimes, sometimes we don't want to hear what people have to say. And so how do you kind of, unravel what's constructive and what's not constructive? But also recognizing that, this kind of mindful practice of being in the now, that's how I kind of look at it, is this NOW acronym, is recognizing that it is non-judgmental. So when you are developing awareness, you're not labeling it or criticizing it or comparing it with something. You're really just kind of observing it for what it is. Okay, yes, I have this very uncomfortable feeling, and I'm not sure what it is. I just know that it's not something I'm experiencing well right now, kind of a thing. It's like I know it's not something I want right now, kind of a thing. Yet it's there, right? So you're open to it, and you're developing this kind of curiosity about it. That's one of the things that I think children are really great at, is that they're so curious about things, and they want to just they ask like a million questions, and it could be sometimes very frustrating for parents and stuff, but they want to know about different things. And so that's how they develop, their ways of looking at the world, is by this curiosity. And so I think we lose some of that as we get older. We lose that ability to be curious, because we get conditioned as we grow. And so we stop being curious, and we stop wondering about things for the most part. And we kind of stay in this conditioned space, which doesn't really allow for creativity or openness or being expansive. And then, what you can do to help with awareness for other people is, giving constructive feedback. And, again, that may also be something of, how do you do that to be constructive? But being, listening in an active space, sharing your own experiences, sharing resources, those are things that can help with developing awareness or helping people develop awareness. It's not like saying you're not being aware right now, that you're doing this. That's not what I'm suggesting here. I'm suggesting more like, if a person is wanting to be more aware about certain things and they're asking for your help in that you negotiate what that might look like. Okay, you want me to help you identify, whatever. So how do you want me to do that? Because I don't want to just say, hey, you're being an idiot right now, kind of a thing. That's probably not the most effective way to do it. So there are constructive ways of doing this. So I'm just throwing that out there, that, It may not be received as well, depending on how you share that. So here's the information about civility. I thought this was fascinating when I was looking into this, and I thought it would be interesting to just kind of share it with you in the service of, mental health and substance use disorders. And I know we only got about 5 minutes, and so you will have access to this information, but I do want to kind of just go through it really quickly. And this is the institute you can go to for more information. But this is the definition of civility, is that it's claiming and caring for one's identity, needs, and beliefs without degrading someone else's in the process. I mean, how neat is that? I mean, that's like, I was like, wow, like, that's amazing. Like, where was this definition? Like, when did this come into existence? Because I've never heard this before. And so I really like the fact that, Brene Brown, she's known for her research on vulnerability and shame. And so I really liked this quote that she also had about civility, that she had said, if we could just get that part about civility, then I think we'd have it nailed. So claiming and caring for my identity and my needs and my beliefs without degrading yours. We would be able to be more vulnerable and less shameful about things, and being able to be more respectful to people and people's values and spaces. And that so relates to mental health. I mean, when you think about it, right? That how is it that I can get my needs and my identity and, know what I believe in and stick with that without degrading who you are, without shaming you, but yet not, degrading myself in the process of that too, right? And so here's kind of a comparison of what some of the research kind of showed too, and this is mostly in the workplace, but what they found is that when people are incivil or uncivil, I'm not really sure what the term is, but if you kind of think about when people are disrespectful, we've seen an increase in this, and I've seen a lot of this like on Facebook and, on some of the apps, that I belong to, about how people are talking about just like how people's lack of respect for other people have increased, or not being able to know how to talk to people. Like, this is the kind of stuff that's been coming up, that people are noticing these things. And so there's increased stress that people experience, risk of violent substance use, dissatisfaction. There are effects that happen on the ability to process information and how people actually perform. It affects how we do work, our productivity. And then it has an effect on our health as well. And so then, when we are demonstrating civility, by definition, there's an increase in psychological health and safety. We feel safer. And so whenever we feel safer, that increases everything exponentially for our health. Safety is a huge thing. It's a basic primary need that we have. We establish that with our caregivers. We establish that at birth. If we don't have that, that trust is not there. And so if we're not in the world, our being in the world, it sets up a lot of other things to happen. So civility is, part of this comparison. And so when we look at, kind of what happens is that there's this kind of mindset that occurs, right? So here's a comparison of what happens for individuals. And you could see, this, how it relates, right? When people are in this stress, anxiety, fear mindset, it's very much survival, defensiveness. People are kind of just doing the bare minimum and trying to get through it, because they don't have the energy and the capacity to do more, right? And when people are misusing substances for whatever reason, perceptions are altered. They see things differently because of the substances. There is a lot of avoidance and isolation. And then also, defensiveness that occurs and mood swings. And then when we have civility in the house, I was going to sing a song with that, but I decided not to do that. There's also kind of like this, respect that occurs. There's more authenticity. I mean, really, it's about, setting and respecting boundaries of people and being able to create a space that's safe and recognizes, that there's a psychological safety and a physical safety that exists. I need to feel that I could be myself around you, and I'm not going to be, that in the event that something does happen, that I could either take care of myself with that, or that you are not going to be retaliatory or defensive with me about that. So there is that safety level. So here are some suggestions, with safety, or I'm sorry, with civility. The foundation of it, and I have these references too that I'll give you as well, but the foundation is really the dignity, the worth, and the respect. And this is, the civil disobedience. There's these great leaders that provide examples, and just recognizing that, there are different personalities in the world, and there's different perspectives. People have their own perspectives. So with the self, the interactions that you have with you, it kind of goes back to that awareness. And just recognizing, how are you being compassionate with yourself, being reflective, taking an inventory, being curious, etc. Asking yourself, is what you say to yourself true? Is it kind? Is it necessary? I really like that phrase. And I know the reference is in the last slide here. And is it productive? And then with other people, I really like this notion of the I-thou relationship. This is Bulber, who's a philosopher, that comes up with this. And he talks about how this is like a third level of relationships, and it's really the connective level. And it fascinates me that there's actually levels of interactions with this, but that's kind of what this relates to. So it eliminates a lot of this negative kind of uncivil behavior that exists. Offer productive and corrective feedback, focus on commonalities, facts, think before you speak, and is it productive? And so that's kind of, I know that was very quick, and I apologize for that. I know we're out of time. But also, really quickly, if anybody has any comments or questions, I just want to put up the references so that you could see where I got some of these resources and information. But if you have any comments or questions, I know we're out of time, but I just want to keep that open for a minute. Okay. Well, I do want to respect everybody's time. So I do appreciate you being here. Thank you so much. And we will see you in 2 weeks. So thank you for being here. Thank you for listening. I hope it was helpful. And thank you, Pramila, again, as always, for hosting.
It was a very useful session, Dr. Serena. Very informative.
Thank you. And we will see you in 2 weeks. We'll have a guest speaker talking about, like I said, domestic violence. So thank you.
Thank you, Serena.
Thank you. Bye, everyone. Thanks for being here.
Bye-bye. Bye-bye.